What do you do when you don't understand something in nursing school? That's what we're going to talk about today, and I'm going to show you guys exactly what you need to do. But if you like these Tuesday test tips, be sure to hit subscribe, and you'll get a new one every single Tuesday. So the scariest thing as a practicing nurse or as a preceptor is when a student comes on the floor or a new nurse enters the floor and they never have questions. That's really scary to us as practicing nurses and experienced nurses, because we know there's a lot of things that nurse still needs to know. We know there's a lot of things we still need to know. If you never have questions, it's very scary. So that's the first thing I want to tell you. If you encounter something that you don't understand in nursing school, is it's okay to not understand and it's okay to ask questions. Now, the moment you hear something that you don't understand, shoot your hand up in the air as fast as you can and just ask why. If your teacher says, hydrogen and potassium have a inverse relationship, shoot your hand up in the air and say why. If they can't answer that question, that's okay. Start digging into other resources. Places you can look for other resources are, first of all, NRSNG. We really have a ton of resources there to help you understand these things that maybe you're not understanding in class or your teachers aren't able to explain. Another place you could look would be other textbooks. If you've gone through your textbook and can't find the answer, throw it out, find another textbook, see if you can find the answer there. There were times when I had 4 or 5 different textbooks open, trying to understand different topics. Another thing you can do, guys, is start study groups. I used to study with this brilliant nursing student. His name was Trang. Loved him. He teaches some of our courses at NRSNG. But when I didn't understand something, I would just ask him. I'd say, "Hey, Trang, do you understand this?" And he was able to explain it to me in a way that I was then able to get it. So study groups can help because other people understand things differently. Now, like I said, the first thing you do is shoot your hand up in the air, ask the teacher. Now, what about those teachers who don't want to give you help or say it's not their job to help you? If you encounter those professors, start working your way up the chain. Go to the next person in line at the nursing school, the next person in line, the next person in line. This isn't causing trouble, guys. This is requesting the education that you're paying for and that you deserve. Now, if you're still not getting any help with that, guys, just keep on digging. Don't be afraid to ask why. Don't let administrators or professors who tell you it's not their job and you're not able to find the answer discourage you from asking why and digging deeper and deeper and deeper. So what I'm suggesting, guys, is dig into books, dig into NRSNG, start study groups, ask your professor, keep asking, keep asking, keep asking. If they don't help you, move on up the chain. If you still can't get help, do not let that discourage you from asking why. We need more nurses who understand, we need more nurses who think critically, and we need more nurses who are able to start filling in those gaps. And lastly, guys, don't leave open loops. If you have a question in your head and it's to understand a disease process better, don't just turn that off. Keep that question burning until you find the answer. All right, guys, this is John with another Tuesday test tip from NRSNG. Go out, be your best selves today. Happy nursing.